there's a period in time in a child's life typically between the ages of 6 and 12, where the goal of that latency period is really kind of to explore the world. It's when he asked if he could do something to me and I didn't know what that was going to be, and I said yes, I then had self-blame and guilt about having said yes. I start these negative connotations to sex, or sometimes I start positive connotations to sex. So we are living in a society where the normal sexual template is really not being developed, and we have the vast majority of people, probably 99% of people, walking around with the sexual template that's really not healthy. That pornography is child sexual abuse.
For to cry, I paid the price for every lie, and I for an eye. Oh, why? And I'm standing in a line of shame, just couldn't take the blame, hoping for a change, but everything's the same. It's still the same. I'm running out of things to say. I need it yesterday.
Hello, I'm Craig, and welcome to a conversation with Dr. Douglas Carpenter, acclaimed clinical psychologist specializing in helping men heal from the trauma of childhood sexual abuse.
I'm Lorward, and as most of us here today, Craig and I are also survivors. The Men's Division of Voices Beyond Assault hosts these monthly programs because we understand that men who suffer sexual assault are not always heard. We want to amplify their voices, empower them to heal, and provide the resources needed.
And as such, we would like to first remind you that this program will contain discussions about emotional, physical, and sexual abuse, and may also include explicit language. The purpose of these programs is to put a spotlight on the healing journey specific to men. However, these programs are all-inclusive.
We are honored, we are pleased, we are laughing, we are having a great time with our guest today, Dr. Douglas Carpenter. As we stated at the beginning of the program, Dr. Carpenter, besides having his PhD in clinical psychology and an MS in counseling and substance abuse rehabilitation, Dr. Carpenter is an amazing author of Secret Shame, a survivor's guide to understanding male sexual abuse and male sexual development. Dr. Carpenter lives in Michigan with his wife, two children, one daughter-in-law, and his 3 very special Spaniels. Dr. Carpenter, thank you so much for joining us today as we call this part 2. There's so much amazing information, so much that we've learned and discovered in our conversations with you, so many great tools for survivors in your book that we could not possibly go into everything in just one program. Our last program is focused on your findings on some of the technical aspects of abuse. This program, or part 2, will delve into the specific effects on childhood sexual abuse on men's sexual and relational developments as adults. Thank you so much for joining us today.
Well, thank you so much for having me. I greatly appreciate it. Look forward to it.
Yeah, thank you, Dr. Carpenter. For our audience, this program will probably be a bit heavy, especially in relation to part 1, although I think it's always heavy when you're talking about childhood sexual abuse. But the topics we'll be covering in this program, we feel, are so critical to understanding the effects that abuse has on those of you who are survivors. So it has been considered a touchy topic. We're going to try to normalize this topic because we think this is a very important discussion to be had. So we're going to jump right in.
And Dr. Carpenter, you have touched upon this before for us, but kind of walk us through again about how there aren't many books on childhood sexual abuse for male sexuality, and what made you decide to make this the focus of your book, Secret Shame?
Yeah, there's definitely a dearth of research in relation to sexual abuse as it relates to males, and there's a ton of research as it relates to females. And so I've been working with male childhood sexual abuse for the last 25 years. I never felt like I had a really helpful resource in this area that I felt like was comprehensive enough and explained it to victims and survivors in a way that they could understand. And so I decided to write one myself. So I set out to write one, and it took about 6 years of a lot of heavy research and writing to arrive at this book. The other unique thing about the book is that I often see so much of a correlation between sexual dysfunction, sexual compulsivity, sexual acting out, and just problems in an adult's, male's sexual life and intimacy life who have been abused. And so this book also links those two topics and shows how they're related and how one can result in the other. So that was another key piece for me writing the book, because I never found one book out there that linked the two in the way in which I chose to write about.
Yeah, and I think that when you this is very special. I call it my second Bible. When you look at it, you discover that you're not alone in a lot of ways. I mean, I think that we as male survivors first think that we're not alone, but then reading your book, when it gets into the effects and how it's impacted your life, and we don't even realize it sometimes, how it's affected our lives. You're like so comforted that this is okay. There is an explanation for this. There is a reason that this is going on with me in my head and for other people. So I want to talk.
I mentioned this in the book that there is no such thing as a child sexual abuse syndrome. So we've not really been able to identify a specific set of criteria that would indicate someone's been sexually abused. There are some common threads and common themes and common symptoms that survivors do have, but really this is something that happens to a child and is so idiosyncratic. It's so the effects of it are so individualized that it really takes working with someone on an individual basis to help them work through this trauma. We can't just, you can't as a clinician say, well, I think you've been sexually abused. And if you start making suggestions like that, you can implant false memories in a person's mind. And so there just is no syndrome that we've been able to identify, and it has to be taken on a case-by-case basis. So when I work with an individual, that's exactly what I do. I treat them as an individual. Their story is unique. Their symptoms are unique to them, and the impact of their trauma is very unique.
Yeah, so you say that and I hear you, but I think there's a lot of commonality in the effects that we all have experienced in our adult lives. And so, while you're reading it, it's not like every single one is applies personally, but there's a lot of comfort in knowing that other people have had these specific reactions and things. And one of the things that I think was the most, I don't know if I'm going to use the right word, epiphanical, or no, it was an epiphany in me. I don't know how to use that as an adjective, but
yeah,
it was an epiphany. The most epiphany moment for me was when you talked about that a lot of men, including me, by the way, that were abused before puberty. And in your book, you talk about the disruption that this causes to the latency stage of development. So I want to talk about this because it's so important. I had no idea that there was this time in development that could be so impacted, and it really did matter how old you were and where your brain was in development when the abuse occurred. So can you talk about the latency?
Yes. So first, let me start out by saying that in all the research articles, the hundreds of research articles that I was able to find about male sexual abuse, the average age of abuse happens for a boy between age 8 and 9, typically. Now, of course, you're going to have outliers, some, 5-year-old, 12-year-old, you're going to have outliers, but the research shows that it often happens between age 8 and 9, which tends to be just slightly a year or two younger than the average age that it happens for girls. So let me start by saying that. And age 8 to 9 is smack dab right in the middle of something that Freud called the latency period. So Freud came up with 5 stages of what he called psychosexual development. Now, some people think, oh, Freud, he was a quack, but he really wasn't. I mean, I tend to love the man. I know he had his issues, as we all do, but he really, I think, was ahead of his time and ahead of the curve, but just didn't know how to fully scientifically prove some of what his theories that he came up with, of what he was seeing in patients. So there's a period in time in a child's life typically between the ages of 6 and 12, where the goal of that latency period is really kind of to explore the world. It's about the accumulation and the acquisition of learning various skills. So if you think of a kid from age 6 to 12, that's where they're learning to become independent. By 6, I can go to the bathroom by myself. I can start getting dressed by myself. I can make some choices about what I want to wear, that, this shirt does not go well with these pants. I learn how to fish. I learn about sports. I learn about all these life activities. I know when I was during this age, like before I was 10 years old, I could get up and fry eggs for myself in the morning. I actually knew how to run the wash machine. So these are things, the life skills that you're learning. You're cognitively at a stage where you are learning the how-to of life. You are not in any way in a sexual stage. Usually at this age, boys hang out with boys, girls hang out with girls. You may have a neighborhood girl that becomes your friend and she's okay, but overall, most girls have cooties. They're yucky. They're silly. They scream a lot. I don't want to play with them. They want to do stupid stuff. That just, and I'm not saying that I'm not being sexist in any way and making any comments like that, but we tend to have more stereotypic behaviors during these ages. And sexual information and sexual development typically lies dormant during this age. It's not till the induction of puberty that there becomes a shift out of the latency stage and into the genital stage that Freud talked about, where, that's where your sexual development comes along. Now, if we look at the research in the average age, boys are abused at 8 or 9. Also, we have this confounding variable now where the average age of porn exposure for boys is 8 years old. So you have all this sexual and sexualized information coming into the latency period. Also, movies, television. There's a lot of sex in TV shows now. And so this information is entering a child's mind and being put in their visual field during this latency period where the mind is not ready to process and comprehend what is going on. And sometimes that can really flip the switch and turn on that level of curiosity and maybe sometimes even fear of it at an age when they are not even supposed to be being exposed to sexual type information. And that can really begin to wreak havoc on the child's sexual development.
Yeah. It seems like you are building this base of blocks and you're taking something you're taking blocks out and then adding blocks on top and being like, oh, we're going to skip you a couple steps ahead. That I'm
Right.
assuming it creates a very shaky foundation for a child where you're
Very
missing
much.
something and stacking things on top is just like compounding factors.
Right, because they don't know how to interpret those things yet. At that age, sometimes you don't even have the language
Mhm.
for it. Like I know with my own perpetrator, when I was 11 years old, and this person manipulated me to the point that I had an ejaculation that included semen. I didn't even know what semen was. I didn't even know that something like that would come out of my penis. I'd never even had someone else touch my penis except for the doctor when I went to get a physical. Like I was so unaware of anything of a sexual nature that when he masturbated me to the point of ejaculation, that I can't even say that I have memories of it being pleasurable. I mean, if I can be graphic here, I really remember that moment feeling like if this guy keeps doing this to me, I'm gonna pee all over him. Like, but on some level, it did feel good, and I didn't stop him. But I was like, this tension was building in me, and I thought I'm gonna pee on this guy, and then all of a sudden I ejaculated, and it actually scared me. I felt terrified. I didn't know what this was. I was like, did he break it? Did he harm me? Like, what is this? I didn't even have the language to describe what had happened to me. You know, and that's part of that latency period. Like, kids are not educated during this time about sexual things, and nor should they be, because again, they're not cognitively ready to process that information or understand what was going on. And I know that from personal knowledge that I truly was not ready for that to happen. And
Yeah, I was 9 and it was oral. You know, I was strangled till I passed out, and when I woke up, he's doing this oral stuff on me, and I had no idea, but I also knew that I had just been like, I better be quiet because I had just been strangled. So what else is he going to do? And but it's so confusing because you're like, I don't know why he's doing this. Why would anybody want to do this? Because you have no idea that this is even a thing.
well, right. So in my own situation, the person exposed me to pornography. And of course, I was aroused by the pornography. And then he said to me, can I show you something that feels good? I said yes, because I didn't know what was going to happen. I didn't know
Right.
what was coming. No pun intended. You know,
Yeah.
he then started doing something to me. And so then afterwards, I knew that like this person shouldn't be touching me here. But I already knew that I shouldn't have been looking at the pornography. I knew that I was doing something wrong or questionable, and I didn't want to get in trouble. So and when he asked if he could do something to me and I didn't know what that was going to be, and I said yes, I then had self-blame and guilt about having said yes.
Yeah.
And so for years, I did not view what happened to me as sexual abuse, because I would always say to myself, well, he asked and you said yes. But I had no knowledge
Right.
of it. I didn't have the language about what was going to happen. And so, you know, it took me some years to admit that me being exposed to pornography from this man's father was abuse. And then what the boy did to me, having more sexual knowledge than I had, was also abuse.
Yeah. In your book, you talk about this notion of imprinting, and I kind of wanted you to talk about like what is imprinting, what are its effects, why is it important?
Yeah, so I guess I could talk about this for a while. Um, if we trace it back, the point of origin that I'm going to start with, I mean, there was a more ancient church person or a philosopher that kind of laid some groundwork for this. But when it really became popular was with a psychologist, I believe back in the 50s or the 60s, named Conrad Lorenz, where he saw that like when a mother duck or a mother goose had little babies, that those babies immediately imprinted on the mother and they followed him around in a line. I mean, we've all seen a line of ducks, right? And so they started understanding this idea of imprinting in what we call a critical period of development. And a critical period of development is where an organism or a species gains specific knowledge that becomes a specific blueprint for behavior. Okay, so if we fast forward that into psychological theory, it started with a researcher, I think the last name was Money, and he looked at something called love maps, like how we're attracted to individuals that we form relationships with and how we imprint on them. And then Patrick Carnes came along later and developed this whole idea of sexual imprinting and a sexual template. So let me take a little bit of time and explain this. And I'm going to start out with a story of what imprinting was designed to look like and how it's morphed. Okay, so I know that all of your listeners are probably not from a Christian standpoint, and that's okay, and I respect that. But kind of what I'm going to say is somewhat going to come maybe from a bit of that framework. So let's look at the process of maturation. Somewhere between 11, 12, 13 is where kids entering adolescent typically go into puberty. Some go in earlier, some come in later. Girls tend to enter puberty earlier than boys, start to get periods anywhere from age 9 on. So that starts a little earlier for girls than it does for boys. So puberty starts. You start seeing that girl that you thought had cooties and that you threw the football in, and when it hit her, you laughed. All of a sudden, you kind of have more of an interest in her. You start thinking about her in a different way. Suddenly, she starts becoming attractive. Oh, I like her curly hair. I like her blonde hair. I like her dark eyes. Whatever feature starts attracting you. And if we think about this, you go through a process of then maybe you hold the girl's hand. You get dared to give her a kiss on the cheek. At some point, you invite her to the school dance. And then you continue maturing to, wow, you're at an age now where you can date. And then you go out and you date and you have fun with this person. Eventually, you fall in love with this person. Eventually, and it may be the same girl, it may be a different girl. You find somebody at some point to marry, and then you marry them. And after marriage, you get to enjoy a sexual relationship with them. Through that process, you have imprinted on the girl. You love the girl. The girl is the thing that you want to conquer. And when you get her, you get the privilege of having sex with her. Now, that would be what I would call an ideal normalized template. But what happens when a boy in a latency period, or even in an early puberty period, gets exposed to sex, either through pornography or through sexual abuse? that sexual template that we hold now is not imprinting on a person that's a love object. That person starts imprinting on the sex itself, or the sexual experience begins to write a message on the sexual template. So in the first scenario, the sexual template would look like attraction to girls. Girls are a female, and I know I'm only talking about heterosexual sexuality right now. I get that. My attraction is to the girl. I want the girl. I want to obtain the girl. Then I get to have sex. So that's what's on the template. The sex is a byproduct of the establishment of connection, intimacy, and relationship. In the second scenario, immediately sexual information is written on the template. This felt good. Maybe my body betrayed me. This man is touching me in a way that I feel like my body should not be responding to me. And I'm actually now angry at my body. I'm angry at my penis for getting erect. I'm angry at my penis for ejaculating. I'm angry that he penetrated me, from behind me. I start these negative connotations to sex, or sometimes I start positive connotations to sex. Like, wow, that felt good. That was interesting. I'm curious about that. I want to know more about that. I want to experience that. I want to do the things that I just saw in pornography, or the things that my abuser exposed me to in the pornography. I want to recreate that. So I start acting out with other kids, recreating what happened to me. Or I return to my abuser for more because he showed me that this was something special that's just between he and I. Or I get gifts when I do this with him, or he spends more time with me and gives me more attention. Other things start imprinting on that sexual template. For a boy who then has no sexual knowledge of the female or a female body, is now imprinting on that penises arouse me. They do something sexual for me, because my body and my mind are now being conditioned to enjoy the male body, when that was not my original sexual template design. Now, I've had other homosexual men tell me that they knew that they were homosexual and were attracted to boys before their own sexual abuse took place. I want to make it clear that I am not saying that sexually abused boys end up being homosexuals, or that that sexual abuse makes them gay. I am simply talking about conditioning right now. That's why I think men can grow up and say that and self-identify as heterosexual men and still have attractions to other men that are a result of abuse. That is just simply conditioning. And I think there are a number of men who've been sexually abused who do grow up with some degree of same-sex attraction and curiosity and arousal patterns, even if they truly are heterosexual. It's just the result of information that was written on that template. And research also shows that our first sexual experiences are often very, very intense. They're intense, they're emotional, sometimes there's risk involved, and all of those things create a chemical reaction in our brain that stamps that memory into our minds. And then we often chase that or go back to that early experience. And so those early sexual experiences can become a blueprint for further behavior. Most of us, if I asked you tell me about what it was like last month having sex with your wife. I don't know. It was just normal. We just got in bed. We had, a little bit of foreplay, and then we had intercourse. Okay. But if I ask you to tell me the specifics of the night you lost your virginity, you could, unless you were under the influence of a substance, most of us could tell you pretty intricately about the night we lost our virginity. Because that's stamped in our brain, because it was a new experience. It was something that was novel for us. It was something that was full of emotional energy, and it's been stamped into our memory. Where, if I describe sex with my wife a month ago, I probably can't tell you any super specifics about it, because it's something that's regular and I do all the time. So those initial experiences heavily dictate our arousal patterns from our early sexual templates. And that's why some people have unwanted behaviors in their sexual repertoire, because of those early experiences of what they were exposed to, what their body became conditioned to, what their mind became conditioned to. And I talked a little bit in our previous session about cues. Men often, so this sexual template holds our cues. And oftentimes those cues become written on those sexual templates, and they become strongly part of our draw to arousal. So there might be a certain thing, there might be a certain color, there might be a certain smell, there might be a certain body part, there might be a certain inanimate object that was involved. For example, this is a crazy story. I had a mentor one time who talked about how she was treating a young woman who was obsessed with horses. And when they uncovered this, when they dove deeper into this, every time the girl was sexually abused, she was in a room where there was a statue of a horse, and she would stare at that horse and dissociate while the abuse was happening to her. And she developed an affinity for the horse, because the horse was the thing that rescued her from the atrocity that was happening in the moment. So that horse became a cue on her sexual template of something that she went back to and drew her to, because she was able to dissociate from the negative aspects of what was being written on her sexual template. So I've said a lot there.
Yeah, no, it's very key to your book. I mean, that's why we started out with this, because you have to understand the latency and the imprinting stages in order to have the rest of the discussion. And that's
Right.
why I wanted us to hit on that. I'll tell you, when I read the normal ideal normalized template in your book, I was very angry. I became very angry that I didn't get to have that, and it really pissed me off. And I remember just having to sit with that for a bit, because I was like, it's not really fair that I didn't get to have that. It sounded so wonderful,
I would say the majority of people in today's world don't get a normal sexual template development because of the interference and the prevalence of pornography and what they're being exposed to, and how sex is so much a part of our society. And I said this in the last episode, but we've got this flipped. We've got apps like Grindr and what's the swipe one for heterosexuals?
Tinder.
Tinder, yeah. That's all about finding sex first and then getting to know the person.
Yeah,
we've got this completely backwards. So we are living in a society where the normal sexual template is really not being developed. And we have the vast majority of people, probably 99% of people, walking around with a sexual template that's really not healthy.
and that's so critical.
We see an increase in sexual compulsivity, sexual deviance, sexual problems in our society. People craving sex, forcing sex. Yeah, I'm sorry, I interrupted
Well,
you.
I mean, it sounds like pornography in your view, and it sounds like it makes sense, is a perpetrator of childhood sexual abuse in itself.
Absolutely. And I make that statement in the book that pornography is child sexual abuse. You know, if you're an adult and you choose to view pornography, that is your adult choice. But and you are cognitively, I say cognitively mature enough to process that information. Although I will tell you that I have adult men come in and say, well, my wife doesn't respond like the women in pornography, or my penis isn't the size of these guys in pornography, like, and there's all these things wrong with me. I can't last 30 minutes like the guys in porn. Well, yeah, because you don't have a video camera splicing and taping, you know, pieces of you having sex together that makes it look like you can last that long. So even grown men sometimes come in with a very, very mistaken perception about what sex with another individual is supposed
Well,
to
unless
be.
but there are cases, right, where grown men are addicted to pornography because of their abuse.
Oh, absolutely.
That has led to it.
Often, if I can get a client to tell me about the type of pornography they are drawn to and look at, or the content of their sexual fantasies, I can more than likely tell you what your core issues are. Like I had a guy last week who I said, tell me about the kind of porn that you're drawn to. He's like, it's always one guy with two women. Okay, what's going on with those two women in the scene? Like, and it all came down to this man getting all this love and attention and affection from two women. Well, we started looking back into his past, and when he was 15 years old, his parents divorced and his mother abandoned them, basically emotionally abandoned him. And that had such a profound impact on him. And it's now, when I drew that parallel, that it's interesting to me that you lost the female who was most important in your life and the attention and love that she gave you at 15 years old. And now at 35, the kind of porn that you want to watch is two women being all over a man. He burst into tears and said, this is what I'm lacking. This is where this came from. It was such a hurtful thing to lose the attention and love and care of my mother at 15, that now I feel like I can't get enough attention from women. Mm-hmm. So the kind of porn that we watch and our sexual fantasies are a direct indication of some unmet, wounded childhood part of us. I fully believe that. And that's why I always work with people to trace back to, and I mentioned this last episode, but their origin story. Where did this originate? Where's the wound here that led to this behavior? And it's all symbolic. It happens in a very symbolic way, because in adolescence, when we go through puberty, especially boys tend to sexualize and eroticize their childhood wounds. Somehow we develop sexual fantasies that make us feel safe, wanted, nurtured, and usually whatever those fantasies are will tell me, at least as a psychologist, where the original pain was and what the pathway there is for healing.
Mm-hmm.
We hear. Oh, go ahead, Lorward. Sorry.
Yeah. I was just going to add that in recognizing that, hey, we do have things backwards. There's an opportunity to acknowledge, like, hey, this is where things went, or this is where the narratives have kind of formed around. And in addressing those, we can kind of start to shift that dynamic of sex before love and intimacy to love and intimacy, and then sex as a byproduct.
Right. And I tell men all the time, like I encourage them, and young men as well, but you need to date this woman. Go out and get to know her. And then if you fall in love with her, stick your penis inside of her. Like, Why would you do that on a first or second date? Just for self-gratification. That's not love. That's not connection. That's just you gratifying. That's you masturbating with a vagina.
But if that was imprinted in your brain because of childhood sexual abuse, and that is the only thing you think that your value is or that your
Yes.
purpose is, that could be an explanation for that. And then how do you change that? Then once can you change something that's imprinted on you, on your template? It sounds so permanent. Can you
Well, it is permanent.
erase that?
I think you can look back, find that origin story, find the meaning of what you're doing now. Is okay. So if that were the case, I think we have a society of people that are trying to find intimacy through sex. And if we can understand that those are reversed, and we can teach people how to grow into being mature adults and what intimacy is and what true connection is, yes, it's going to go against your grain from everything that you've been taught. It's going to go against your grain to, take a girl out and date her for 6 months, a year, whatever, before ever becoming physical with her, that you really get to know the individual. Yes, that's going to be a huge paradigm shift inside of you. But I'm involved in a community called Husband Material, and Husband Material is all about teaching men how to outgrow porn. We have to mature as a species, as a society, and get back to healthy living and not just gratifying living. That I work with clients to help them understand their sexual template and how it developed and where did things begin to go awry? Where were the faulty mechanisms? Where were the faulty beliefs that then resulted in behavior that's not been good for you and has not led you to getting the outcomes that you want in your life? And what do we have to do to reverse those? What do we have to do differently to help you grow and mature and get the outcome in life that you actually want? Are you going to live by your arousal? Maybe some things that arouse you just happen through conditioning. Like if you were sexually abused by a male and your body became conditioned to respond to another male, I doubt your current wife wants you running out and occasionally having sex with men. That's probably going to cause a disruption in your marital relationship. So let's go back and understand what's in that template, how it developed, why it's there, give it a name, build some boundaries around it, figure out how to nurture that part of yourself and grow into your actual marital relationship. Just like with an alcoholic, drinking alcohol may be fun, but the result of it may be detrimental. And you may always want to drink, but you may decide that I'm never going to drink again because of where this takes me. And it takes a lot of work sometimes to figure all that out and how to bring healing to that. It's not an easy process sometimes to walk through sexual abuse and the impact that it's left you with. But it can be done.
And it's worth it.
And it's worth it.
Yeah, I think kind of like you had said, you want to give this notion that there's hope for you to change. And I think that's very relevant to what you're saying now of, yes, in recognizing where you were hurt, and then also being able to nurture and care for that part of yourself of saying like, yeah, I felt really abandoned by my mom when I was divorced at a young age, or I felt really neglected by my father when he was working all the time.
Right.
And being able to see yourself in that state and then to show yourself that compassion and that nurture can really
Yes.
help you, and correct me if I'm incorrect about this, kind of redevelop that latency stage and reorient the love, the intimacy, and the byproduct of sex.
Yes. I tell people all the time, you have to learn to reparent yourself. we do a lot of inner child work.
Mhm.
Like there's a form of therapy called internal family systems where we work with the different parts of us. And
Mhm.
sometimes I will combine that with inner child work and have the adult part of you go back and talk to that 8-year-old boy who is getting abused. What is the adult part of you now, with the knowledge that you have, need to go back and say to that 8-year-old? How can the adult part of you communicate to this 8-year-old that this abuse isn't his fault, and that he doesn't need to feel responsible for this, or that he doesn't need to no longer carry the shame that's been involved with this? So it's a lot of internal processes in inner child work, in internal family systems work, to talk to these various parts of ourselves, to bring about healing, and as part of reparenting ourselves. We're a generation that has failed to learn how to self-soothe and self-nurture. We are constantly looking for something outside of ourselves for the answers for our internal problems.
Mhm.
And it takes a lot of work sometimes and someone to help guide you through that process, because some of this just isn't automatically, individually intuitive. You don't wake up today and think, oh, I feel really dysregulated. I need to spend some time with my inner child and find out what's going on with him. Like, why is he so present today? But
Kind of
if I
like,
can train you to think that way, just for an example, like when I was 19 years old, my car battery went dead. And I wasn't a very overly masculine male at the time, but I had a friend in my friend group who was like the stud. Every girl wanted him. He was gorgeous. He was muscular, all this stuff. Well, he walked over and jumped my car with jumper cables. And while he was doing it, I got so angry at him. Like, here this guy is rescuing me from my problem with my car. And internally, I'm raging at him. And I had to step back and ask myself, what is going on with me right now? Like, why is all this this anger being projected at him when he's trying to help me? And I guess I've always been kind of psychologically minded, but I stood there and traced it back to, I'm really angry at my dad right now because he never taught me how to do this. He never taught me how to rescue myself if I got into this kind of situation. And I'm angry at him for not teaching me this, but yet I'm projecting that and displacing that onto the person who is helping me right now.
yeah, the incorrect imprinting. Yeah.
Yeah.
Okay.
And we have
I
to learn to know ourselves. You have to get to know yourself. That's why I named my business Insight Counseling Services.
Mhm.
Because I am a strong believer in insight, that you have to have insight into yourself and your own mental processes to then understand your behavior and to then make good decisions about your behavior.
Yeah. Speaking of insight, in chapter 13, you talk about the self dilemma of ranging from happiness, gender confusion, gender identity, hypermasculinity. Can you talk through some of these emotions and give us some insight into them?
Yeah. I think when a child is in the context of sexual abuse, you immediately start making interpretations about yourself and what happened to you. And the vast majority of them, because you're in the latency stage and can't process them, result in faulty beliefs about yourself. So some of them might be, well, I must be gay and I don't know it. This guy must have seen me as gay. Or because he used my body like a female, now it's feminized me. I am now confused about my gender because he made me feel like a girl. I'm not like other boys now. Somebody's penetrated me. I can't tell anyone. I'm dirty. I'm bad. I'm defective. I'm unworthy. No one would love me if they know the truth. They might jump into hypermasculinity. I need to now prove that I'm a boy, prove that I'm a man. So I'm going to become angry, aggressive, a bully. I'm going to beat people up. I'm going to prove to the world my masculinity. I'm not going to let this man rob me of my masculinity, even though internally I feel like he has. But outwardly, I'm going to do the exact opposite of that and prove my masculinity. So just in that rant of all those reasons, you can see how childhood sexual abuse can have such an impact on the way that you view yourself. And it can go from just feeling shame about the event into what we call toxic shame, which believes that I am just a bad person. Who I am is inherently bad. And so the self, sexual abuse destroys and tears apart the foundation of who you are if you fall into these disbeliefs, these cognitive distortions about yourself. You know, an 8-year-old, 9-year-old boy they don't even know who they are yet. But yet they start believing all these horrible things about themselves because of what's being done to them. You know, it's almost like the concept of neglect is worse than abuse, because in abuse, at least I'm getting some attention, maybe negative attention. But in neglect, I'm not even worth you paying attention to. And how does a child interpret that? And a child has a very egocentric world. We think that as children, we have the power, that things happen because of us. Mom and dad got divorced because I wasn't a good enough boy, or I caused too many problems, or I got bad grades and it caused them to fight and they got a divorce. You know, so the child's thinking becomes very distorted when negative and bad things happen to them if there's not someone there to walk them through and explain the world to them. So does that
Yep.
kind of answer your question there about all the things that can happen to the self when something traumatic happens? It's all about how that child falsely interprets the scenario.
Yeah, no, that totally makes sense. And I think when you were listing off some of the cognitive distortions, I was like, yeah, that a lot of those sound really familiar.
Yeah.
Yeah.
We all have them. We all have cognitive distortions. But how are we taught to challenge those about ourselves, about our behavior, about the way we look? You know, and what are the messages about those things from society?
You talked earlier about getting to know yourself, and I think that a lot of survivors spent their life not getting to know themselves because they were wearing a mask so that they could, and I'm one of them, could keep that secret behind them, and that secret shame.
Yeah, because who I am is too shameful.
Yeah.
I don't want anybody else to know me. I don't even want to know myself.
And sometimes the result is that, and I know that you know this because I read it in your book, sometimes the result is the opposite, right? Where sex becomes a terrible, terrible, dirty thing. I don't want anything to do with it. You call it sexual anorexia.
Anorexia, or now the buzzword is kind of intimacy disorder or intimacy anorexia.
Can you talk about that a little bit, and how does one fix that, right? If they're completely stuck in that space.
Well, I will tell you that sexual anorexia is difficult to treat, and it's usually a very kind of long, lengthy process. But somehow in the child's mind, they have become and feel so defective that they can't engage in intimacy or connection. Or what happened to them was so horrifying that they can't allow themselves to experience arousal. And so they become very avoidant of sex. There was, I think, 2 men that I interviewed for the book that had never allowed themselves to enter into an adult sexual relationship with another person or have a relationship because they just didn't feel worthy. They felt too broken. They felt too dirty. They felt like, I don't know how to have a relationship now because of what happened to me. You know, sexual anorexics or intimacy disorder people, and I talk about this in the book too, have not yet separated abuse from love, sex, and intimacy. It's all in one pot, and it all the main ingredient there is their sexual abuse. You know, like I talk about in the book, there's a guy named Vince who used to have so much anxiety when he would have sex with his partner that he would wear a couple of condoms to prevent himself from having premature ejaculation. The whole time he was having intercourse with his wife, he would just be praying for this to get over it, is that she would have an orgasm as quick as she could, and it could just be over. And in fact, when he would ejaculate, sometime he would chant under his breath, I'm sorry, I'm sorry, I'm sorry. Because sex was all about an abuse scenario for him. But yet his partner wanted to be sexual with him. But the whole time he was having sex, he was flooded with flashbacks, intrusive memories of his own abuse. You know, and I worked with him, and I'm still working with him, and this area of his life is resolved. But we had to spend a lot of time talking about what is abuse and how do we separate that out and put that in this box and resolve that, and how do we turn on our ability to be aroused, and that our body, we can allow our bodies to have sexual pleasure that's adult, that's appropriate, that is consensual, and that we can begin to enjoy this side of the equation with a loving partner, and it is not in any way connected to what went on over here. Now, that's a journey.
Yeah.
It is a journey, and it takes a lot of helping the person learn to become comfortable with their own body, comfortable with allowing somebody to touch them, how they interpret that touch, how they interpret their partner's love toward them, and how they want to express that, teaching them how to stay present and not dissociate in the middle of, or even at the beginning of having sexual intimacy with their partner. Like it took a lot of hard work that was very focused, and he had a lot of determination to turn this around for him. You know, but he really had the drive to do that. And some people just think it's too hard, I can't do this, and they just stay stuck.
Yeah. On the flip side of that, you could have hypersexuality, where the person has sex all the time, but could it be the same? Because really, it's there. You know, the anorexia is you can't necessarily have the intimacy disorder, and it turns into hypersexuality. So the person can have sex.
That of course can happen. And you're getting into an area where I'm doing a lot of research now. And when I write my book about how males who've been sexually abused by females, that is going to be a part of it. Because throughout the 25 years of working with men, when I find a man who's been sexually abused by a female, they tend to become what I call man whores. They will screw anything that will let them. And I think there's a lot of undoing going on here. So, for example, I had a guy who at 13, an older 28, 29-year-old woman who he worked with, he had a work permit and he was able to work at that age because of his family's poverty status. She took him to her apartment and had sex with him. When boys are not ready cognitively, physically, mentally, emotionally for that kind of behavior, what you see is them develop a mindset of, I will never let another woman hurt me like that again. So I am going to be the aggressor. I will be the one in charge. I will be the dominant party in sex. I will screw you before you screw me, literally. Like, and I'm going to, that made me feel like I was raped. It made me feel so emasculated because I wasn't ready for that I'm going to regain my masculinity by proving myself as a man by having as much sex with as many women as I possibly can. And I'm going to gain all that back, and no woman will ever do that to me again. I can't tell you how many times I have seen that scenario from men who have been forced to have intercourse with women before they were not ready.
And both of those are operating from a place of that first origin of pain rather than a place of this is love, this is intimacy, and this is a byproduct.
Absolutely.
Okay.
Yeah, because
So
those men will tell me I screwed women that I didn't even think were attractive. It wasn't even about how they looked. It was just about power and control and regaining my sense of masculinity and not being taken advantage of. Like, it's a mental process. It's not, it doesn't have anything to do with the laws of attraction. And it's coming out of a wounded part of that person and going back to that original sexual template and trying to bring healing to that, just in a way that's not good or healthy for them.
So for both of these people who are, if we look at a horseshoe, while we might think like, oh, they're totally different from each other, like the intimacy anorexia and the hypersexualization, while we think they're on opposite ends, it's like, well, on a horseshoe, you guys are much closer together than you may realize. For both of
Yes.
these individuals, I'm assuming that the treatment starts again always with where is this coming from and how do we re-parent, rewire this aspect of ourselves?
You made a great phrase there. How do we rewire that? Yeah.
And so
there's a
follow-up
phrase that says neurons that fire together wire together.
Mm-hmm.
And so, early in your exposure, your synapses are being wired a certain way. And the more emotional material and risk involved in that, the more dopamine, the more norepinephrine, the more neurotransmitters in the brain quickly create those synapses. And then that becomes the way our brain tends to think and work. Mm. And it's sometimes hard to rewire that. It takes a lot of conscious effort and insight and exploration to rewire your brain.
And someone to help you, most likely.
Yes. And someone to help you. And not just I'm going to get in trouble now. Not just going to some regular therapist who does cognitive behavioral therapy and trying to adjust the way you think about something. Like, I call that Band-Aid therapy. Like, I'm sorry, I know I'm pissing a ton of people off right now, but there's so many clinicians out there that I think they have absolutely no clue what they're doing. I think it's the type of therapy that I do and that a lot of my colleagues do is such deeper work than just, you coming into therapy and I give you a 5-step model of how to do this. And, you're going to think better and you're going to walk out rah, rah, rah. You're going to be all better. Like, no, that's not how true therapy works. You know, and usually in true therapy, you get worse before you get better. People don't probably want to hear that either, but you know, coming to therapy is not a cakewalk if you really come to therapy. It's hard, gut-wrenching work, but in the end, it's worth it.
Yeah, I
It's a
remember
slingshot.
when I started therapy, I had more nightmares and more things than ever. And I was
Because
like,
I'm
oh
asking you
wait,
to,
this is not supposed to be.
I'm asking you to think about and talk about things that you've tried to repress and keep locked down and keep secret for years and years and years. And I'm asking you to take an authentic, raw look at yourself, disclose that to me, and let me help you rework that. And that takes a lot of guts and vulnerability. You know, and men in our society are not taught to be vulnerable. Vulnerability is seen as a weakness.
Well, that even sounds harder than the disclosure itself. I mean, the first step is disclosure, but it sounds even much more difficult to be that vulnerable and get that in depth.
I mean, you may find some healing just by telling your story, but typically there's a lot more work to be done after you tell your story. But that is a huge, huge first step. And I don't want to discount that in any way, because you know, that's like learning to drive, getting behind the wheel for the first time. You know, it's taken that step. You know, it's the first time asking a girl out. It's taking that risk.
Yeah, I want to maybe give a little bit more of a practical approach. So when individuals are looking like, hey, I want to start therapy, I'm looking for someone who can help me with this specific modal of understanding where my origin comes from. Like, I guess, like, can you give a framework of like what kind of therapy I should be maybe looking for, or what kinds of things I should be wary of? Is
Yeah,
that like,
I mean, I would definitely look for somebody who's trauma informed, maybe who does internal family systems work, who they may say that they do individual therapy or internal family systems therapy, IFS. There's a type of therapy called emotionally focused therapy that's typically used for couples, but that theory now has what's called EFIT, emotionally focused internal family, or emotionally focused individual therapy. So I would look for that. So those are like deeper forms of therapy. They're not just like going to scratch the surface and look at behaviors.
What
You know,
about hypnotherapy and EMDR and all these new catchphrases? Shock therapy is something I thought I needed for a long time. What about those?
okay, I'm a supporter of EMDR, which is eye movement desensitization reprocessing. So there's research studies that will back up the use of EMDR, and it's really how your brain processes trauma. That can definitely be part of the healing process. And I'm definitely a supporter of that, brain spotting. So yeah, there are techniques like that that are helpful.
And then there's one I heard about from some people that I know that they took, I think, some kind of LSD or something in a therapist's office, and then but I think that's used mostly for PTSD, just to recall, or what? Have you heard of that?
Yeah, absolutely. So there are some forms of therapy that are kind of newer right now that have to be done in controlled environments, and it's the use of micro doses of psilocybin or like some kind of psychedelic drug that really helps your brain unlock things that have been stored, and it allows the emotions of that event to come forward. But it needs to be done in a very controlled environment with a microdose, with somebody who can help lead you through that process. You know, I've seen in this world where this is happening, I've seen like retreats where we're all going to get together and we're going to take a psychedelic and everybody's going to work on their emotional issues. This isn't about just getting high and having some like psychological trip. This needs to be done in a very controlled environment. And when it's done in a controlled environment with a clinician who knows how to use that technique, there have been a lot of positive results, especially in the area of PTSD. So I'm not opposed to that. I'm just very opposed to it being advertised in very inappropriate ways.
Yeah.
It's just like I'm not opposed to medical marijuana if it's regulated and used in the right way, but I'm not for just having a marijuana center where any Tom, Dick, and Harry can just walk in and buy whatever they want to help put them to sleep, decrease their anxiety, blah, 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 blah.
Well, that goes for any drug, doesn't it? I mean,
right.
And a lot of abuse survivors abuse drugs, and they look for drugs to mask the pain and things. And I've had a couple, a really good friend in particular, who committed suicide as a result of his drug use to mask his abuse. And
Absolutely.
So there's a fine line between how that it could help you and how it could hurt you.
Right. And I'll just quickly mention this, and I have a chapter about this in the book, but Patrick Carnes came up with 8 different ways that a person bonds to their trauma. And I think in therapy, that's one thing I do. I try to figure out how have you bonded to your trauma that's now causing you an adult problem. And sometimes in like trauma, he has one category called trauma blocking, and that's where people will use drugs or alcohol or some kind of mood altering substance to just numb their brain so they don't have to think about, they can just block out the trauma. And that's where you end up with a lot of addiction. So sometimes the reason, and this is actually came into play with that study that showed that men often don't disclose for 25 years after their abuse. A lot of times men who are sexually abused, who end up with some kind of life problem, actually come into the penal system. So you've had 3 DUIs. So I start digging into this with you, like, okay, why do you have these DUIs? How much are you drinking? What are you drinking for? How do you feel when you drink? What's the purpose of your drinking? What underlying emotions are you trying to numb out? And then it will come out, well, I was sexually abused at 15 by a coach for 3 years. Oh, so you've been using alcohol to numb this pain, block this memory, and not deal with all of this. And you've been an alcoholic for the last 15 years. But that's not the presenting problem of why they came to treatment. They came to treatment because they were an alcoholic. Well, when we strip the alcohol away, what's underneath there? It's just like I said earlier, chase the pain, you'll find the healing. Dig into that alcoholism, and where does it take you? Where does it take you back to?
Of the 8 ways that people bond to their trauma, do you find that trauma blocking is probably the most common way that males specifically bond to their trauma, or are there some other ones that you're like, these kind of float to the top as well as more often?
Well, that's I know you don't mean it this way. That's kind of an unfair question to me, because the type of trauma bonds that I would probably end up seeing are people who have trauma repetition, trauma shame, trauma blocking, because they're going to present to me with some kind of mental health problem, substance abuse problem, or some kind of sexual problem. So based on what they're coming into my office for, when I give them the test that shows me where they fall in those 8 categories, I can usually already know where they're going to fall. I just want to make sure. So the type of clients that I end up seeing are probably going to fall into one of those more categories. Now, what the overall research says about where they fall, that I'm not sure about. And because this is such an individualistic process, if you had repeated abuse that was over and over and over, what we might call type 2 trauma or a big T trauma, or what they call adverse life events traumas now, you might be more inclined to dissociate. So you don't remember that. So then you're going to fall into trauma, splitting, where you split off from part of yourself and you chronically dissociate, or you may jump into drugs or alcohol, or that may have been so traumatic that you then fall into a pattern of constantly repeating the behavior, which is going to be trauma repetition.
Can you have a lot of
are going to fall
person
into like trauma shame.
Yeah. Can a person have a lot of those 8? I mean, it's like, or at different periods in their life, go through different parts of those. And
yes, they can switch. I usually look at the top 3 scores, the top 3 out of the 8, and what is the interplay between those.
But they might have gone through one earlier and they don't go through that one anymore, and they have a different one now, and
right,
that could happen, right?
Yeah. Or how do they interplay? Like, do you get triggered during the day and you're having a lot of dissociation that feels really uncomfortable for you, so you go to the bar and you drink a bunch? Well, then you've just went from trauma splitting to trauma blocking, and so those 2 things are paired for you.
I mean, I can relate to a lot of those.
then you become drunk, and then you search out some female in the bar to go home and have sex with that is really mean and nasty and controlling, or into BDSM or something. So then you've jumped into trauma bonding, like then you've bonded with your perpetrator. So like one can lead to the next, it can be a complicated process where you just think, as the victim, you and the person who's all this going through, you just walk around thinking, God, I'm so effed up. I'm so messed up. I can't figure out what's wrong with me. Where I can go, oh my gosh, I totally know what's wrong with you.
So wow, a little too close to home on this, but I forgot my question even now, but is there a correlation between how long the abuse occurred for children, like if, in my case was 9 to 14, or if it's a one-time thing? Is there a correlation to that? And
actually, no.
No. Okay.
Actually, no. Which is shocking.
Yeah.
There's no specific correlation. Like, the longer you are abused, the more severe your reaction is going to be. For example, I treated a man who at 7 years old was somewhat kidnapped for an afternoon by a group of people who sexually and ritually abused him for about 4 or 5 hours. And that guy has astronomical trauma. And it was a one-time event. And so, like I've used this word before, this is very idiosyncratic. Like, it can be a one-time event, or it can be something that happens many times.
How about the age?
Sometimes, no, not that I can think of. I can't think of any research I could cite where, certain ages end up with more trauma than others. And I do want to say this, that in 2017, the American Psychiatric Association did a lot of research and pumped out a document that showed that 40% of males who are sexually abused have no remaining problems or symptoms. They're resilient enough that they get over it. But that leaves 60% of men who've been sexually abused that end up with some kind of resulting problem in adulthood. So I just want to be clear that I'm not saying every person who's sexually abused is going to end up with all kinds of life problems. That's simply not the case. We are resilient human beings, and the human spirit is resilient.
Well, I mean, for so many years, though, I felt like I was in that 40%. that was resilient, right?
Really, you
And
were just in denial, right?
You're just repressing it real hard.
that's kind of where it ended up being. I didn't
Yeah.
know that I was having all these effects and that it was affecting me in all of these ways. I really didn't realize it until it just started snowballing. But I mean, could that be the case where people, that 40% just don't know it yet and they should be afraid? I mean, should it be anybody who's been sexually abused go and get help, because you never know when it's going to sneak up and bite you in the ass? No pun intended.
No, I know. I don't know. I don't know that I would go on a limb that far out and say that. I mean, if you truly are have turned out to be a well-functioning individual with healthy relationships and you were sexually abused, then I'm so happy for you. I'm happy that it didn't impact you that way. And I'm not going to sit here and say, well, someday it's going to sneak out and bite you in the ass. I don't know that. I don't know your internal workings, that you truly might be a really resilient person. What I see more though is men who come in and don't understand the connection between their abuse and their current behavior until we start connecting those dots. And I don't ever just assume when somebody comes in, oh, they've been sexually abused and I'm gonna dig this out. No, I let them tell me their story. And that's why I say, well, when can you think of other times in your life that you experienced this exact emotion that you're having today? And usually they uncover those things on their own. And it's a moment of insight, like it's the epiphany that you were talking about earlier. Oh my gosh, the first time I felt this way was, a day after I'd been sexually abused. I went into this deep depression. Oh, okay, tell me about that.
But what I'm hearing is, for at least 40% of the population, this is an issue that can be readily solved, resolved, and moved forward with, given whatever modalities you choose, whether it be, hey, I don't need to go to therapy, like my internal family systems are strong enough to create a narrative out of this that isn't
Yes.
fueling more shame. And for some, it's coming into your office and saying like, hey, I don't see the connection with these two things. And then you help them discover the connection.
Yeah, like some guy might be able to say, that happened to me when I was, when I was 15, that 17-year-old, in the locker room when nobody was in there, grabbed me and did this. And that was really fucked up on his part. And, what a douchebag. He shouldn't have done that to me. And I, none of that was my fault. And, I pick up tomorrow and I move on. That's possible. Absolutely possible.
I think that just gives a lot of people a lot of hope. Like, hey, like there is a way to, whether you have, a messed up imprint, or your latency stage in development was really messed up, or you have these dysfunctional patterns that you're struggling with, or, your relationships are suffering because of the things you've been through. There is a very, very real opportunity here to do work that will resolve those things.
Yes.
And maybe even make them better than they are now. Or
absolutely.
Yeah.
Absolutely. I agree with that, or I wouldn't do this kind of work.
So what makes the 40%? I mean, I don't want people out there to say, oh my gosh, I'm not as strong as the 40% because I am not resilient enough to have conquered this. What differentiates the 40% from the 60%?
Well, I would say that it's probably the one big thing that strongly contributes to this is the quality of your upbringing. If you had a mother, a father, or you had adult individuals who really attuned to you throughout your life, met your emotional needs, helped you develop self-worth, self-efficacy, agency, that's really important. That's why it's, I'm going to get on this soapbox again, but that's why it's so important to be the best parent you can possibly be. If you're going to have children, you're making a lifelong commitment to be the best parent you can possibly be. It is your job to supply the emotional, physical, cognitive needs, spiritual needs of your child. You know, in my first book, I talk about, it's called Childhood Trauma in the Non-Alpha Male. My wife and I sat down and wrote this chapter, I think 24, which is like the second to the last chapter in that book. But it's the top 25 tips for good parenting. And so
Ooh,
and I wrote that chapter, and it's the whole chapter, if I could sum it up, it's really learning to emotionally attune to your child and how to truly be present for them and their emotional needs. But what we see is so many adults are trying to vicariously live their lives through their children, or they're neglectful and don't have time for their children, but it's socially acceptable to have children, you know, but I'll let the TV or the internet raise my kid while I go, you know, go answer the 96 emails that I just got from work after 5 o'clock.
I was having a conversation with my brother-in-law. He works in education, and he said primary school should not be the primary educator of your children. You are the
Absolutely.
primary educator of your children. And at the time, I was like, yeah, that makes sense. But after talking to you some more, it seems like, yeah, we keep drawing back to this idea of either one, trying to be the best parent you can for the children that you do have, or two, trying to be the best parent for your present self and
Yes.
attempting to try to rectify and reconcile the past with new tools that you have.
So I will put a plug in for this. And the two sound like they're completely unrelated, but honestly, the best parenting book I've ever read was written by Pia Melody, and it's called Facing Codependency. In her book, really talks about how the basis and the origin of various mental health disorders, but really she provides a blueprint in there of how to be a good parent to help prevent these things. So the book sounds like it has absolutely nothing to do with parenting. When I read it, I thought this has everything to do with parenting and how to be a good parent. And again, that's Facing Codependency from Pia Melody. And it's actually a kind of an older book at this point. It's probably 30 years old.
I want to shift a little bit before we run out of time to the relationships that abuse survivors have with their partners, their spouses, or their partners, and it obviously has a lot of effect on that relationship. Um, can you talk a little bit about what survivors can do to minimize that negative effect or repair something that has happened until they came
Yeah.
forward?
Well, one thing, and we've already kind of talked about this, but you have to psychologically separate your abuse from your current relationships and find ways to truly join with your partner. You know, I think after your abuse, you develop this layer of self-protection and you keep the world like this, and you're too afraid to let someone else in. And oftentimes with sexual abuse victims or survivors, I try to use the word survivors instead of victims, but I will actually walk them through a guided imagery of what does their personal boundary look like. And often it's like, it's a stone wall. It's like layers and layers and layers of a brick wall that nobody can get through. And then slowly I have them, what would it be like if we removed one brick? What would it be like if we removed two bricks? What would it be like for you to create a doorway where your spouse could come into your sacred space? That you would feel safe enough to let them in to where you truly live. Because these people have lived in such a protective barrier, mentally, physically, psychologically, emotionally, that's ultimately why it ends up being an intimacy disorder. I'm too frightened to truly experience intimacy and authenticity and connection with another person, and I have to protect myself from being hurt again. I don't know how to be vulnerable. The best thing you can do for your relationship is honesty and vulnerability. That's how we connect.
But sometimes it's hard, it's difficult for the partner to understand the effects that sexual abuse has had on their spouse or their partner.
And that's why the
Two,
partner needs to read my book.
good point.
So they can understand. Touche.
Mhm.
Right? That the partner needs to be educated about this too. That
Mhm.
this isn't just their spouse reacting badly to them, because they're going to think, well, what's wrong with me? What'd I do to you? Why are you treating me this way? Why will you not let me in? Why won't you share intimacy? Why won't you have sex with me? Why do you always want to get sex over? Why do you treat me like a piece of meat? Why do you, they're going to constantly, we view the world through our own lens. And in a relationship, sometimes I have to take my glasses off and I have to put her glasses on. And I have to try to see the world from her viewpoint. And if you're married to somebody who's been through sexual assault, you definitely need to try to see the world through their lens as well. And that's why it's important to educate yourself about their experience and for them to be able to share your experience with you, and you learn how to appropriately attune to your wounded spouse.
Kind of the installation of empathy that we had talked about before we had started this program, of not only are you able to see me for the way that I'm acting, for the way that I'm hurt and how that's affecting you, but I am able to see how my wounds are affecting you. And hopefully through that mutuality, there is an understanding of, I see where you're at, I'm able to help you to grow. And, one of the beautiful parts of a marriage is we're in this together. You don't have to do this alone. And hopefully that's the place that you're able to go to together.
Right. Well, so my wife is a therapist as well. So you can imagine how jacked up our house is, right?
There's a lot of inner family systems working there.
Yeah. So sometimes, we'll be in a discussion or starting an argument or something, and I will say, you're really triggering my inner child right now. My inner child's going to show up because you are triggering him, and he's getting ready to be very defensive with you. And for example, one time I remember this, my wife became very upset with her parents about something and she was crying. So I went and got her and I sat her down in my lap and I asked her to just talk to me about what she was feeling. And I fed her Hershey's Kisses while she talked. That was me attuning to her feelings. That was me attuning to the wounded little girl in her who was being hurt by her parents. Yeah. And we have to be attuned to our partner's emotional self and their inner child. My wife is a very strong, independent woman. And a lot of guys would be very intimidated to be married to her. But she grew up with a dad who treated women like they should be barefoot and pregnant and in the kitchen. And that is not my wife. My wife could be the CEO of a company. She really is. She's the CEO of our company. But I see the value in that. I know where that comes from for her. I don't feel threatened by that. Some guys have even said to me, man, she is so strong-willed. How do you do it? But I see the wounded little girl inside of her who had to learn to be strong and independent. And I see the beauty and the value in that. But that's really knowing my spouse and knowing my partner. And I think if you're married to someone, you have an obligation to get to know that person inside and out. Like, if you come into a relationship and that person has baggage, it's your job to sit down and open up that suitcase and go piece by piece of what's in that suitcase so you can understand their baggage. Because being married to somebody, I don't want to be triggering them. And if I can understand what triggers them, then I cannot do that and help the relationship be healthy.
Great
That's
words of wisdom.
That's my
Yeah.
marriage advice for the day.
Doug, I think that is a great place for us to kind of put a closing cap on this. I think you touched on it. Looking through those suitcases is looking for that pain, and that's where you'll find that healing. And
Absolutely.
we just want to thank you so much for joining our program. We're definitely going to be reaching out to you again. We're so looking forward to your book about parenting that's going to be coming out soon. Thank you for sharing all your amazing findings. I feel like there has been so much wisdom and so much hope. I would very much say, I think that's definitely a feeling that I'm getting of there's so much opportunity here. It's going to take work. It's going to take effort. It's going to take finding the right therapist who's not just going to put Band-Aids on something, but who's willing to dive deep into those things. And we just thank you for all the work that you do for survivors. We're so thankful that we've been able to have you on for this new program episode.
Thank you. It's been my pleasure.
Thank you. And you know, this is the best book ever written for survivors. And please go out and get a copy and read it today, because you won't be able to put it down. And for all of you survivors out there, speaking of hope, we hope you found this discussion enlightening, comforting, and helpful with your healing process. Please look for our YouTube channels on all major podcast sites for this program, part 1, which was equally riveting with Dr. Carpenter, and as well as other programs from the Men of Voices Beyond Assault.
Yes. And finally, please send us your input. We love and value your input. There will be other information at the end of this program on this site in the notes. Thanks again to all of the survivors out there for being continued supporters of these programs and organizations such as Voices Beyond Assault. It's your courage that gives us all strength.
Hands on my chin, I was lost and looking in the glass of time. Was it just the wine made me cry? I hope I'm satisfied. I saw myself, an older man, folding up his paper plans and hiding it in his hands. Made me say, am I okay? Don't say too late tomorrow, too late tomorrow.